Hi, my name is Adana Llanos, and I'm an assistant professor in the Department of Biostatistics and Epidemiology at Rutgers School of Public Health. The title of my flash talk is The Stress of It All: Higher Levels of Cumulative Physiologic Stress Before Breast Cancer Diagnosis are associated with more unfavorable breast tumor features among Black women in a Women's Circle of Health study. As the title suggests, in this study, we found that higher allostatic load, which is a measure of chronic cumulative stress, was associated with increased odds of unfavorable breast tumor features, including higher tumor grade and larger tumor size. So why is this important? Well, it is important because long-term cumulative physiologic stress is one of the earliest markers of increased morbidity and mortality, and is associated with increased risks of adverse health outcomes, including cardiovascular and metabolic disease risk. An analysis of data from NHANES that was published in 2016 showed that higher allostatic load was significantly associated with an approximate twofold increased risk of breast cancer among Black women, while no association was observed among white women. But the caveat of the NHANES analysis was that allostatic load was measured after women were diagnosed with breast cancer. Building on the findings from NHANES, we hypothesized that higher allostatic load before breast cancer diagnosis are associated with poorer outcomes among Black women with breast cancer. Using data abstracted from the medical records from up to 12 months before breast cancer diagnosis among 409 Black women who were enrolled in the Women's Circle of Health study, we estimated two measures of pre-diagnostic allostatic load. And we then assessed the associations of these measures with various breast cancer outcomes. The concept underlying the potential role of allostatic load on breast cancer is that physiologic responses that are initiated and maintained in an attempt to achieve allostasis, particularly in response to exposures related to chronically stressful conditions, might contribute to more aggressive tumor phenotypes and subsequently to shorten breast cancer survival among Black women. The findings from regression models, which controlled for age at diagnosis, birthplace, marital status, menopausal status, and family history of breast cancer, are shown in the forest plots here on the slide. As shown in the first forest plot, higher allostatic load score, as measured using a lipid metabolic profile-based measure, was associated with a significant increase in the odds of poorly differentiated tumors compared to well-differentiated or moderately differentiated tumors. In this case, the allostatic load measure was classified as a lipid metabolic profile-based measure because the biomarkers included in the composite score were systolic blood pressure, diastolic blood pressure, waist circumference, levels of high-density lipoprotein, total cholesterol, triglycerides, and glucose, as well as use of medications to control hypertension, diabetes, or hypercholesterolemia. As shown in the second forest plot, higher allostatic load score, as measured using the inflammatory profile-based measure, was associated with a significant increase in the odds of poorly differentiated tumors and larger tumor size. The second allostatic load measure was classified as an inflammatory profile-based measure, as the biomarkers included in the composite score were systolic blood pressure, diastolic blood pressure, body mass index, waist circumference, estimated glomerular filtration rate, serum levels of albumin and glucose, as well as use of medications to control hypertension, diabetes, or hypercholesterolemia. This was the first study to report on potential consequences of elevated allostatic load on breast cancer outcomes, and we showed that higher levels of cumulative physiologic stress up to 1 year before breast cancer diagnosis are associated with higher tumor grade and larger tumor size. More studies are needed to fully understand the longitudinal associations, particularly in studies that include more diverse study samples. Thank you for your time and attention. I would be happy to answer any questions via email.